Good morning and welcome to this week's Let's Talk. Thank you all for joining. I know we put some couple of TVs up so people could join who don't have channel 22. Appreciate that. And again, as always, appreciate how kind our residents have been to the staff and how kind our staff always is to our residents. Always makes a situation like this a little easier. Lots and lots of nice comment cards, lots of pats on the backs coming in. Lots of nice emails from family members as well. So again, we definitely thank you all for that. So where are we today? As a state, as Maricopa County, our numbers continue to increase on positive tests for coronavirus. There are now 25 retirement communities in the valley that have active cases. There are currently 23 people still in the hospital and 77 positives in those 25 facilities. And that was yesterday as of around 2 o'clock we got those numbers. So again, coming closer and closer to home. Westminster Village still does not have a positive case, which is incredible, which is fantastic. And somewhat lucky and somewhat that we're just blessed. We hope to be able to continue that streak, but the reality is as it gets closer and closer, we got to do more and more to make sure that we don't end up one of those 25 facilities or one of the 35 that might be there by next week. So what does that mean for us? We continue to do what we're doing for sure. There are a couple of changes that are going to come out in the letter that comes out tomorrow. One of those changes is a fairly simple one for most people, but will affect some others, is our staff are now all coming in the N1 door, and that's been going on for several weeks now. What we want to do is make that an employee-only entrance. We want to continue to have those barriers between staff members and residents, as us staff members are probably the greatest risk to our residents because we're off campus going home and having interactions with our own families possibly. So we want only staff members coming in that N1 door, and that means we're going to shut that hallway off starting tomorrow morning. I forgot what day of the week it is anyway. So the N1 door will be, and that hallway going up to the employee break room will become a staff-only area. And again, that's to protect residents from that interaction with the employees. I also ask that if you're walking your dog or walking around the campus, we found some residents are gathering at that door to thank staff members as they come in. Again, we see that as a huge risk to you residents. Don't do that. We're coming up with other ways for you to be able to interact with staff as a not in-person interaction. It's so critical at this point and over the next couple of weeks that we follow those barriers that are put in place. They're in place for the protection of everybody. So the N1 door, again, that will come out in the letter that goes out tomorrow. The other thing that will be changing today, and we've been playing with this a few different ways, but any off-campus trips will now be restricted to a isolation for 14 days. Madge is going to continue to review that and decide if that time frame changes, but any off-campus trips, even if they're a doctor trip that's been approved by Madge, it's still going to require a 14-day isolation in your apartment. And that means no going to get your mail. It means all your food needs to be delivered. If you don't have a washer and dryer, our staff will take care of those kinds of things. You'll just need to call home health or concierge, and we'll provide all those needs for you. But again, as this gets closer and closer to home, we need to put more and more precautions in to keep people safe. What do we need from you? We need you to keep being patient. We need you to definitely social distance. Again, we've worked hard to make sure that we don't have this virus on campus, but we've also gotten very lucky. And we're going to continue to work hard and we need to continue to get lucky, but we need to socially distance even between ourselves on campus. And that means conversations with staff need to be different. They need to be over the phone. They need to be via a written pat on the back. They need to be other ways. We do need to make sure we're following that 6-foot rule. We do need to make sure, again, staff is wearing the mask, residents have the opportunity for the masks. But we have to continue to really utilize those barriers, the visible and invisible, and that's avoiding the in-person interactions where we can. It's making our social circles a little bit smaller at this time. The more we do over the next 2 weeks, the easier it is 3 and 4 weeks from now. Continuing to really just pull back a little bit more, and we all know how hard this is. Every single person on this campus has been doing that and sacrificing and not having the visits with family and trying to do those virtually. But we really have to increase the amount of doing that at this point. And then the other thing we need from residents is we need to do everything we can to keep Westminster Village, Westminster Village. And again, how do we do that? We limit the in-person interactions, but we increase the in-writing interactions, the pat on the backs, just the thank you notes to somebody who's doing a good job, a phone call to their manager, a phone call to the employee, phone calls to your neighbors, letters to your neighbors, emails to your neighbors and your family. One of the other things that keeps Westminster Village, it's caring about each other, and that's really working hard to enforce that self-discipline to do the social distancing, protecting each other, limiting that risk that we're going to spread this virus if it does come on campus. It's a critical thing we can do. It's critical that every one of us do it. I've asked Megan, and Megan's activity team are looking at ways where we can be together even when we're not together. Doing things where maybe one day everybody's wearing red, or one day everybody's wearing their favorite sports jersey. Whether you're isolated in your apartment, or you're up in AL, or you're in the healthcare center, or you're an employee who's in the back of the house that nobody sees, we're still in this together. We're doing the same things. We're thinking the same things. Some of the other things that came out of her task force were even just as the shifts change and many people are coming on campus right before 2 o'clock, and maybe as they're coming on campus, we have people out on their balconies, just from their balconies waving and saying hi. Or one day, everybody who's driving through between 2 and 2:10, they honk their horn and annoy all the neighbors. But again, it says we're all in this together, we're all here. Everybody can participate without being in Chapman-Nurnberg Hall or without being in the Garden Cafe. Because again, we need to continue to do the social distancing. We need to continue to make sure that we're keeping each other safe and we're not putting each other at risk. Other things that we really want to do is utilize Channel 22 a little bit more and find ways for those people who don't have Channel 22 to be able to have quick and easy access to those videos. Tomorrow we're going to do the pat on the back meeting. It's going to be on Channel 22. We don't know at time yet because I haven't told Megan we're doing that yet. We were going to do that as part of this meeting, but I think it needs to be a separate meeting. I want everybody to walk away from this meeting going, we've done a lot. We've asked everybody to sacrifice a lot. Every person on this campus has sacrificed a lot. But we have another 2 weeks at least of hard sacrifice. We have to work extremely hard together, apart, to keep this place safe, to keep each other safe. Tomorrow we can, again, do a pat on the back and have some celebrations and really recognize some of those people who are doing a tremendous job. I know in the daily updates that go out now, we're trying to highlight staff members who are doing a great job. Some of that is coming from stuff administration sees, some of that's coming right off of comment cards, some of those come off pat on the backs or other people bringing that to us. And we're going to do a whole day tomorrow of that kind of stuff. But today, I really need everybody to think about how you can be together without physically being together. Again, is it writing letters? Is it emailing? Is it using Zoom or FaceTime? Is it just standing on your balcony? Again, I'd love to see that. Where my office is now, I get to see people usually every afternoon talking to residents up in assisted living with a good 25 feet between them. It's amazing. I've seen people standing on their balconies talking to their neighbors on the balconies. Again, amazing. There are ways to stay together and be together without being 2 feet apart. And again, as a reminder, we're reminding staff, and we're gonna have staff watch this Let's Talk, that it's important and it's not rude and it's against what we've done in the past, but if a resident comes up to an employee and starts a conversation in the hallway, we're asking that staff member to back off and ask to have that conversation in a different way. I'm gonna ask residents to do that same thing. If one of us stop you in the hallway, ask us to give you a call. Again, each of us have a responsibility to keep ourselves safe and each other safe. And I'm gonna ask that we continue to really, really abide by those visible and invisible barriers for at least 2 more weeks. I think all the questions that came in I've answered. At the pat on the back, we'll answer some more of the comments that have come through. We need everybody to continue doing their part. And again, that doesn't mean we haven't been doing it. Everybody's been working extremely hard, every resident, every staff member. We just got to keep this up for a longer period of time. Thank you.